enough geriatricians, so we definitely are trying to train those out in the community, physicians, also students and residents that we work with in the medical school, trying to teach them, that being elderly is a little different. You can't practice the same medicine on a patient that's 50 versus a patient that's 85.
At SLU, we have a geriatric fellowship program where we specifically train physicians to become geriatricians, and that is the focus of what they're going to do for the rest of their lives in clinical practice. But we also feel it is very important to train everybody who is going to touch an older adult some of these geriatric principles. Our goal is to not just stay in the city of St. Louis. We want to move beyond that in the region. We've always had a lot of ties around the state of Missouri into Illinois, and then we also work very hard to form relationships across the United States, being in national organizations.
We've trained people from all over the world, from Europe, from Singapore, from Hong Kong, China, Australia. So we train from all over the world as well. In addition, our program is very well known, and so many of us get invited to teach all over the world, and literally this is from India and Saudi Arabia all the way through to recently I was in Japan and working with them, looking at the new robots that are being developed, which are really exciting to help older people being able to get around. So these are things we do. We do a lot of work with the World Health Organization, looking at what can be done both in developed and developing countries to improve the care of older people.
We are doing this because we can make a big difference in the lives of older adults. We can help to keep people independent, keep them in their homes, and then when a problem does arise, we can make a difference to quell it to some extent and keep the effects from being too severe.
Within St. Louis, the geriatric program, together with the St. Louis University students, runs an inner city clinic that's free for people who are struggling. So I think that's a very important part of what you should do, and it's a real part of doing medicine. Medicine is caring, it's compassionate, and that means providing help for the less fortunate as well as the more fortunate.